Thank you for contacting Wave Support. I see from your clinical request you're struggling with some comfort issues with this patient's new lenses. And as you probably know, these post-refractive surgery patients, especially the RK patients, all these rules tend to go out the window. And so I found various ways to approach a lens like this. If we look at your design, it actually looks like a decent design overall, but obviously you have some comfort issues. And I find quite often what we need to do is really find a good way to land this lens out here in this peripheral area. And there's not any one set way to do that. Sometimes you have to play a little bit with these back zones. The debate is, should you go like you have, kind of setting at the outer range of that red zone, that steeper zone, and setting this one somewhere on in the halfway point like you did. That's reasonable. Sometimes I've had to go all the way over here and just try to match that back surface right to the steepening of the cornea. But one thing you might consider, if you recall, axial designs tend to fit more precisely or represent more precisely the central part of the cornea, whereas tangential lenses tend to give a little bit nicer representation out here in a little truer representation of this peripheral cornea. So if we're looking at trying to establish a nice landing zone, I find sometimes going to a tangential design can be a little bit more effective. And quite often I find patients report a little less awareness with that type of lens. You may also recall that when you go from axial to tangential, it tends to, in general, flatten up that whole lens. So what I did, I mocked up a lens here for you using kind of a tangential design. And I actually did a couple things. I did in tangential, and you'll see that you get a very similar lens design here. But I also use this aspheric tool. I don't know if you've used this in the past, but you'll notice if you stay in a non-aspheric back surface, you get a nice looking design. But if you look, what happens when I go to, for example, this horizontal meridian, if you go to more of a, put a little asphericity in there, you notice it kind of softens things up, so those transition zones, even though you've got to go over all these steep changes in the cornea, when you put a little spheric design to it, it softens up those transition zones a little bit and blends them through a little bit more nicely. So I tend to get a little bit more comfortable fit for a lot of these patients. It also flattens up this edge a little bit more so it doesn't dig in. And of course these rules go out the window, and so even though they look great here on Wave, sometimes you have to use your clinical observations to make some of these changes. So just kind of summarize that. Really try to work on maximizing this landing zone out here if you can. And the best way to do that is maybe look at a tangential design. And then if you notice, when you go over to this axial, you get a really nice representation of the back surface of that lens. Comes very close to matching the imported topography for Wave. So with that, I wish you well with this case. I think you'll do well. Oh, I should mention one other thing. If you do continue to struggle with this design, you may want to even consider going to a semi-scleral or a scleral design. Sometimes going to like a 14 or 15 millimeter lens can be very, very helpful. And in the attached email, I'll include a link to the Wave tutorial that is a nice 8-step approach to fitting a semi-scleral design for some of these patients. So with that, I wish you well. Have a great day, and thank you for contacting Wave Support.